Hello, this is Dr. Do again. This video is on alphabetic list problems, still on letter M. Today I'm not going to talk about any specific disease, but associated with the group of conditions, which is very dangerous, very threatening to the world, actually, it's malignancy, which is a cancer, use a pathological term, a medical term. So before I talk about the malignancy, probably I do not need to bring up, but I still saying the signs for emergency of this malignancy. Probably not unless it is sudden, unknown, undiagnosed malignancy. For example, in the GI system, the stomach cancer or any other cancer caused the severe vomiting blood, or the kidney cancer without known loss of blood. Usually that's not an emergency. I can think the emergency situation associated with the malignancy cancer, the one I just mentioned, the undiagnosed gastric cancer and erosion to the blood vessel, so you have vomiting blood, huge, so that's one of the emergency. The other is the cancer, either the primary cancer in the bone, spine, for example, or the metastatic cancer to the spine and suddenly have this fracture, pathological fracture is called, because it's not from mechanical injury, just because the cancer invasion the spine and impaired, particularly if impaired the neurological function, not just the pain. So that's the emergency situation. And regardless whether there is neurological deficit or not, if you feel sudden, particularly in older people, feel sudden back pain, feel like uncontrollable pain, then probably you need to really go to the emergency room to find out why is the cause, without falling, without damage. Suddenly develop the back pain, very severe and uncontrollable, the medications. So that's probably it's possibility, one of the risk factors for this back pain in older people, sudden development probably is the metastatic cancer, which was not diagnosed, or previous existing cancer suddenly metastatic to the bone. So these are the emergency situation that I can think. The other one is, of course, either the brain tumor, either from primary tumor in the brain, regardless whether it's malignant or benign, or the metastatic cancer to the brain, impaired the autonomic status and impaired other functions. So that is the emergency situation. Usually it's associated, actually, unless it depends on the location in the brain, usually it's still subtle chronic process, like headaches or sensational change, or cannot move one specific extremities, unless the tumor in the critical location cause the impaired respiratory or cardiac function. So that's probably, usually it's not the emergency associated with the cancer, unless the cancer located in a different location near blood vessel, for example, or near the center of respiratory or cardiac center, or the bone, the spine. So having talked about that, can you manage at home? Of course not, because this usually when we talk about the malignancy, it's really take a lot of effort to manage. So having said these two ends of the clinical significance, let me just explain what is the malignancy. Malignancy is not, we usually think, oh, it's a cancer. Of course it is cancer. It could be solid tumor, could be in the blood. It's not a solid, not a tumor, but it's just malignancy. So the malignancy interpreted in medical term is differentiated cells away from the morphology or the function of the original cell. For example, in the blood, we have the red blood cells, the white blood cells, the lymphocytes, the neutrocytes, for example, and one strain, special strain of the cells, for example, the lymphocytes, proliferated in a not normal way, which means increased number, or usually increased number, or maybe associated with decreased number, but usually it's huge amount of number of the lymphocytes under the microscope. It's blue, by the way, the lymphocytes, because the nucleus alkalinic, so it's stained on the blue on regular H&E staining. But those are medical terms anyway. But those lymphocytes, in terms of the number, is huge, but they are not normal functional lymphocytes. Only take the space, take the function, take the life of the normal lymphocytes. So that is the fundamental concept of the malignancy. The same idea for the solid tumor, malignant tumors in solid organ, for example, the hepatocyte, or cancer of the liver cancer, or hepatic cancer. They look like they're probably from the hepatocytes, look like hepatic cells or liver cells, but they change the morphology, not exactly as the original normal cells, and also the function. They do not carry the normal function as the normal liver cell carry. So in terms of the risk factors, in terms of the cause of the cancer, usually it's unknown, unless like some special, like smoking associated with the lung cancer, or the sunlight associated with the melanoma or skin cancer, or some chemicals may associate with the uterus or the liver cancer. Usually in general term, the cause of cancer still unknown. We just know that there is genetic impact. Different people has different genetic coding signals, and that is one of the risk factors. Of course, associated with other either your lifestyle or your chronic damage or chronic injury or chronic inflammation, or decrease the immune function. So those are all of the variety. If you search the cause of malignancy, you'll find a variety of them. In terms of the molecular theory, or the really medical term to understand this malignancy, it's usually the cells undergoing, there's a lifespan. For example, the red blood cells 120 days, and then circulated to the either liver or spleen through those special kind of structure to dissociate, to break down. This is normal death of cells, called apoptosis. One of the mechanisms for the cancer is those cells supposed to undergoing the apoptosis, the regulated cell death, out of the control, not in the normal time, and survive longer than supposed to, or died early, or transformed, or proliferated during the way of growth. So that's really the cause of the malignancy. In terms of I think you probably know it because everybody knows this scary term of cancer. Really, it's still mysteric, I think, in a lot of sense, but the progress has made in terms of clinical treatment. There's some cancers can be treated, breast cancer, for example, prostate cancer, for another example, and also colon cancer. So those are the three most common occurred cancer, and with a good prognosis. Some of the cancers, like some other form of cancers, like the lung cancer, the pancreatic cancer, the kidney cancer, are still not. First of all, the diagnosis is a challenge because usually those small growths of malignancies not generate clinical symptoms. So usually when the diagnosis is occurred at late stage, which means already caused the clinical presentations, that means it's already in terms of size big enough, or the location critical. So that's one of the challenge. And secondly, because there's so many molecular mechanisms involved in this cancer process, so the treatment is another challenge. So that in general, for the patient or for general population, just I think the best way to prevent the cancer is follow the instruction of your physical exam, a yearly physical. And by the way, in terms of screening, not all the cancers are under the guidelines to screen, because there's really not specific, not sensitive. So still the malignancy and the cancer is a challenge for physicians, and also of course it's also a impact the patient's daily life. So I'm just going to stop here. I just brought this malignancy concept here. I hope that if you're interested, you can search more. Definitely you will find a variety, uncountable literatures or studies about the cancer. And I think in terms of conclusion wise, not a lot. But I'm going to stop here, and hope it helps. And thank you for watching. I will see you next time.